GP since 1980. He is multidisciplinary practitioner, hence also practicing acupressure, mantra therapy, which are non-pharmacological modes of treatment of sick individuals. Other areas of his interest are medical astrology, writing poems, arranging health camps in schools and colleges. Recently, Sir started Sarodya Shastra Chikitsa. Sir received Best Paper Presentation Award of GPCon in 2012. He also received GP of the Year award at the hands of Honorable Anna Saheb Hazare in 2016. He had practiced, he had participated in many GPCon and GPA activities. He will be speaking on non-pharmacological, as I said, therapy, acupressure, and mantra. Mantra, the word mantra has come from Sanskrit word man and tra. Man means thinking, and tra means to remove. This therapy acts on mind by its vibration. Mantras can have healing effect by releasing the emotions and bringing about a state of calmness and deep relaxation, both in the chanter and one listening to the chant. Uh, I hand over to the speaker, Dr. Gujrathi sir. Thank you very much.
Namaskar. I am audible to all.
Yes,
am I
sir.
audible?
Yes, yes.
Okay. So, as a part of GPA, as usual, we are always arranging different discussion camps or education CMEs, which improve our knowledge. Always we discuss on different pharmacological treatments, but still something there is apart from this, which is called as acupressure, acupuncture, and it has definitely a very nice role, which I have experienced this last 40 years. And so I wanted to share it, and I must thank GP organizers to giving me the chance to share these my slides and my thoughts to you. Acupressure is a therapy where we give us desirable pressure at different points to reduce the pain, to reduce the anxiety, and sometimes improve the movement of the patient. In acupressure science, there are 12 meridians of our body. Meridian is just nothing but an energy pathway of different organs. Just like other organs we discuss are lung, heart, liver, spleen, stomach, small intestine, large intestine, kidney, bladder, gallbladder. Like that, the 12 organs are discussed, which are creating their energy pathways. And these energy pathways, of course, we are not able to directly show any relation between the energy pathway and the organ. But when we treat these pathways, definitely we see the improvement in the function of the organs. And these 12 meridians, these pathways are called as the meridians. 12 meridians has the 6 sets. 6 are in and 6 are yang. So that way, in is a positive energy, ion is a negative energy, and these keep up circulating from one organ to another organ on that is pair. So liver and gallbladder has their pair. Small intestine, large intestine, they have their pair. Heart and lung, they have their pairs. And this way, we see the energy pathway passing from one organ to another organ, keeping the energy running in a proper way. When there is a block in this energy pathway at a particular point, the function of the organ is disturbed, and it shows, it is seen in different ways. Say, suppose an kidney meridian is there, we think if a given point, the pathway is blocked, it may show edema on feet, edema on face. At some points, it may show the severe pain because of the urinary calculi. And similarly, in intestines, large intestines, we feel the distension of the abdomen. In small intestines, the indigestion, blenching, like that. So when we treat these organs through these energy pathways, we feel definitely good, proud when patient is relieved within seconds. Of course, many times not even any injection is helping to relieve the pain within seconds. And you can also use this therapy very nicely and see the results. With all this primary introduction, I will just give few examples. When there is an acute renal calculus pain, that is renal colic, patient is not able to bear that, and he just turns a minute, second to second from one side to another side till he releases the pain. And at a particular point, say the master point of this is just on the posterior medial aspect of the knee joint, and we give a pressure, firm pressure on that point, the pain is relieved within 2 to 3 seconds. Patient comes to quiet, and then we can further treat by our pharmacological drugs. But till that, the patient is happy because he has relieved the pain. Similarly, in gaseous distension, the pressure point is mainly popliteal fossa. The apex of the popliteal fossa, if you give a firm pressure for 10 seconds to 15 seconds, the distension starts relieving and patient feels better. The blenching is stopped, flatulence is reduced. Like that, some cardiac pain. If suppose the patient is having an MI, severe that chest pain gives a more spasm to the vessels. So in cardiac conditions, if we give pressure on the little finger, medial side of the little finger, or medial side of the palm, that gives definitely a pain relief to the patient. And once the pain is relieved, the spasm of the muscle and vessels is reduced. And so patient chances of survival are increased. One of my patient, he had an MI, and just for a few minutes, I was out of my clinic and patient had severe pain. My assistant was there who was just given that idea, and she started giving the pressure to the point. Patient's relatives took the patient to the hospital, and She accompanied the patient till the hospital, and when patient reached the hospital, ECG was showing a very massive MI, and the resident said that, okay, you are very lucky that you could reach the hospital at this station. So that is really a miracle of this therapy. Similarly, hyperacidity, severe hyperacidity, severe vomiting, and sometimes the migraine. These also have a very master points on our palm, on forearm, and on the back. These give a very nice results. Patient's migraine headache is stopped within 10 to 15 seconds. At least patient can bear that pain. The miraculous result I have seen in the cases of acute asthma. For asthma, the pain is on the shoulder. The point is on just the trapezius. At the angle of the neck, if you give an pressure from superior to inferior and medial, that is inferior medial side, the pain and restlessness of the patient is reduced, asthmatic attack is reduced. Still other points, they are on the scapula, and these also give a very nice result. The scapula point we can locate just like the mid-clavicular line. If it is extended on the back, the line where it touches the scapular upper border, superior border, there is another master point for asthma, which gives us a very nice relief to the patient. Some of the slides, if we can see, here is one slide. It shows many multiple points you can see, and these points will show how the meridians they start. The three meridians they start on the either medial side or anterior side from periphery to the heart, and other three they start from medial to the periphery of the hand or legs, that is extremities. So the meridians starting running from medial side and anterior side, they are from tip to the heart, and the meridians running on the posterior side and lateral side, they run from heart to the periphery. Here are some slides I will try to show. See, these 12 meridians are given there. We can see the names: the lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidney. Then heart governor, that is also called as an sex governor, triple hitter, gallbladder, and liver. These meridians, they are given how many points are there, which point is there, how these are indicated. There is, as I said, that there is no actually physically related points to the organs, but we definitely see the result. Now here is a time circle of different meridians. So from night 11 to 1, the heart meridian is more beneficial or more active. So many times we see the cardiac complications moreover in this time. The small intestine is disturbed somewhere at 1 to 3 a.m. Then bladder 3 to 5 a.m. Kidney 5 to 7 a.m. And at this time, we many times see the patients of renal calculi. Similarly, there is every meridian has a 2 hours time period. And if you are going to treat these meridians, and if you are lucky enough that patient comes for that complaint in that period, definitely it shows and more benefit. It is not so like only the bladder meridian we have to treat 3 to 5. Okay, 3 to 5, if we give the treatment, we can get a more benefit. Otherwise, definitely the results are seen at any time of the day. Also, the similar part of the this acupressure is another parallel part is sujo. So in sujo, we treat moreover on foot and palm. Different organs here you can see on right foot, left foot, different organs are seen. On one side, the liver is there. On the other side, it is spleen. Then medial lateral part is showing some spinal cord regions. On tip, the sinuses are there. And if we treat these sinuses point, chronic sinusitis or recurrent rhinitis is definitely reduced. The restlessness of the patient in breathing is reduced, especially at night when patient gets disturbed sleep because of nasal blockage. These points definitely help to the patient. These are the images for arms, hands. This the meridian, that is different meridians, different points on this. This image is only shown because here is one ischial tuberosity point, which is preferably I have practiced for weight reduction. And definitely it shows weight reduction, especially if patient is having an acquired weight gain because of steroids or any other medication. If we give pressure to the ischial tuberosity or on the pubic tubercles, patient reduces weight even by half to 1 kg in the initial stages. Later on, this weight drop is also reduced to the 200 grams, 300 grams per day. It is not so every day there will be a 1 kg drop. Otherwise, that would have been a hazardous point. But this weight reduction point is definitely a very nice. And this point, otherwise, we can't give an acute pressure because our thumb is not reaching that point. We have to give the pressure with the thumb at such uh, deep seated points. So in our yoga, we always use the Padmasana. But if we use Ardha Padmasana, our heel that touches very nearby this ischial tuberosity and helps to reduce the weight. So if patient is asked to achieve Ardha Padmasana, 15 to 20 minutes, right leg will touch the left tuberosity, left heel will touch the right tuberosity, 15 minutes each. Definitely patient will feel better. And this point has a very peculiar uh, history that what I have seen, that usually this when we try and weight gain weight reduction by diet, the weight is reduced from the periphery first, but here the weight is reduced from the center of the body, abdominal, lower abdominal fat and hip gluteal fat is reduced first, and that is uh, the peculiarity of this point. Also, the pain in renal colic. The another master point is just and lower border of the pubic rami near to symphysis pubis, nearly 1.5 centimeter, 1 centimeter away from the symphysis pubis. If you can give a good pressure, definitely it helps to the, reduce the pain. Similarly, this is an another that increased my curiosity in all this. Right, you can see the position of the ear and position of the fetal place. So if you just imagine the image of a fetus on an earlobe, you can locate the points on ear at which point we can give a pressure to improve the function of that particular organ. So for the pituitary, thyroid, the point can be at, I'll just try to locate it. See, this area, if we can give a pressure in this area, it will definitely improve the thyroid function. Then this just point lower to this auricle eminence is good for pituitary. This ridge, inner ridge, is for our spinal cord, that is this cervical spine, thoracic spine, lumbar spine. This region is for the buttocks, for weight reduction, in fat reduction at the buttocks. We can ask the patient to give the pressure at this point recurrently. But one thing we should remember, no point should be given a pressure more than 90 seconds. Normally, I practice 10 to 15 seconds or at most 20 seconds, not more than that. Because patient has to bear that. And only the point I will tell you that when we start pressing, patient will not feel anything in the beginning, but a point will come that patient will say, ah. So that patient, when patient feels a maximum pressure, keep that pressure for just 2 or 3 seconds and then start reducing a little bit and then give a massage to that point. So just if you have hold the ear, you can massage this way. If you have palm, you can massage this way. So similarly on other points also, you can give a massage. So that reduces the time to the given point. Okay. This way, I have nearly completed the primary part of the acupressure. And now I will just move to the second part, that is mantra. Mantra is just nothing. It is not just bluffing. We can see that these Shad chakras, that is Muladhara chakra, Swadhisthana chakra, Manipur chakra, Anahat chakra, Vishuddha chakra, Ajna chakra, Sahasrara chakra, these are the energy concentrating points on our spinal cord at a various levels. For Muladhara chakra, there are 4 words: Wang, Shan, Shang, and Sam. And when we chant all this at a given rhythm and a given way, a proper pronunciation is there, we can feel the waves or the vibrations in our body. But before all these mantras, we should follow an Omkar. Om is to be chanted minimum 10 to 15 times, 20 times in a proper way with hands directing either anteriorly in front of your body or to the sky. That is the supine position. It should not be in a prone position. You can just experience any word chanting. If you say Vam in a supine position, you can feel few of the waves in your body. Those are spreading. But if you prone your hand, these vibrations are not felt at all. Those who are regularly uh, doing different meditation, they can feel this difference very immediately. Others will require a little time or little bit more practice. What is this mantra? When we regularly chant different mantras, these create different vibrations, and these vibrations are reached to every cell of our body. And our cells at a given particular time are full of these mantras, and anything excess, जसे ग्लास एकदा आपण भरला की जास्तीचं पाणी हे खाली पडतं, तसं आपण ही मंत्र एकदा आपल्या शरीरात रेग्युलर आपण म्हणत गेलो तर आपल्या सेल्स आहेत या सॅच्युरेट होतात, आणि या सॅच्युरेटेड सेल्स यानंतर त्या ठिकाणी आपण जे काही मंत्र म्हणतो किंवा त्या सेल्स मधून ते मंत्र पुन्हा बाहेर जात असतात, आणि या पद्धतीने ते मंत्र समोरच्या व्यक्तीपर्यंत पोचले तर त्या मंत्रांचा त्या व्यक्तीच्या त्या अवयवांपर्यंत जाणारा जो काही प्रवास आहे तो त्याला फायदेशीर. पण हे आपण दुसऱ्यांसाठीच करतो असंही नाही, आपल्या स्वतःसाठी सुद्धा याचा खूप चांगला उपयोग होतो. एस्पेशली माझा जो अनुभव आहे तो आता मूलाधार चक्रावर मी बऱ्यापैकी प्रॅक्टिस केलेली आहे. तर ज्या वेळेला आपल्याकडे सॅक्रोआयलायटिस किंवा सॅक्रायटिसचे पेशंट असतात, लंबो सॅक्रायटिसचे पेशंट आहेत, लंबर स्पॉन्डिलोसिसचे पेशंट आहेत, की ज्यांना मॉर्निंग स्टिफनेस असतो, पटकन उठता येत नाही बेडमधून, किंवा खुर्चीवर बसले तर पटकन उठता येत नाही, काहीतरी सपोर्ट घ्यावा लागतो आणि उठावं लागतं. अशा लोकांनी त्यावेळेला हात सुपाईन पोझिशन मध्ये ठेवून मग याचा जर व्यवस्थित उच्चार केला तर निश्चितपणे काही सेकंदात त्यांना सहजी उठता येतं. सॅक्रोआयलायटिस जे पेन आहे ते अतिशय जबरदस्त पेन आहे, की बऱ्याच वेळा पेशंटला एक पाऊल सुद्धा चालायचं असेल तरी विचार करावा लागतो की मी चालू का नको, मी चालणं गरजेचं आहे का नाही, का मी या ठिकाणी बसून किंवा झोपूनच काम करू शकतो. तर असं जे सिव्हिअर पेन आहे त्या पेनची इंटेन्सिटी जवळजवळ 50 ते 70% कमी होऊ शकते एक 10 वेळा वांगचा उच्चार केला तर. फक्त या ठिकाणी हे जे सगळे अक्षर आहेत वांग शांग शांग, याच्यामध्ये आपण जो अनुस्वार आहे त्या अनुस्वाराचा उच्चार क ख ग घ ङ मधला जो ङ आहे त्याच्याने करायचा आहे. तो एस्पेशली अनुनासिक आहे, म्हणजे नाकातून त्याचा उच्चार होतो. वम आणि वांग हे तुम्हाला आता मी म्हणून दाखवलंय, याच्यातला जो फरक जर तुम्हाला जसं जाणवेल तस तसं त्याच्यामध्ये त्या व्हायब्रेशन्सचा फरक आपल्याला हळूहळू जाणवतो. वांग ज्या वेळेला आपण नाकातून म्हणतो त्यावेळेला ही व्हायब्रेशन्स प्रिफरेबली आपल्या ब्रेनकडे जातात थ्रू स्पायनल कॉर्ड, आणि ती मूलाधार चक्रापर्यंत पोहोचतात पुन्हा, आणि त्यामुळे त्या भागातलं पेन हे खूप झटकन कमी होतं. शम आणि शम यांचा मी इंटेस्टाईन्सच्या कॉम्प्लिकेशन मध्ये एक प्रयोग केला होता. माझ्याकडे एक पेशंट होता IBS. इवन एक अर्धा कप चहा पिला, एक ग्लास पाणी पिलं तरी बऱ्याच वेळा त्याला कंपल्सरी लॅटरनला पळावं लागायचं, आणि ही त्याची खूप अवघड परिस्थिती होती. त्यामुळे त्याला कुठेही बाहेर गेलो पाणी पिता येत नव्हतं, चहा पिता येत नव्हतं, कोणाशी बोलता येत नव्हतं, आणि सगळे लोक त्याला नातेवाईक म्हणायचे की तू फार शिष्ट आहेस, एवढं काय आहे. पण तो ज्या वेळेला सांगायचं की मला हा त्रास आहे, आणि जो ज्या लोकांनी बघितलाय ते कधीही त्यांना कुठल्याही गोष्टीचा आग्रह करायचा नाही. पण हा ज्यावेळेला त्रास त्याचा खूप वाढला त्यावेळेला या शंख, शंख म्हणजे षटकोनाचा श, हेक्झॅगॉन. तर षटकोन का इथे निवडला याचं एक लॉजिक मी तुम्हाला सांगतो. आपण आपल्या रिब्सची लोअर बॉर्डर हे दोन्ही बाजूला तिरपी जाते. लॅटरल ॲब्डोमिनल वॉलची बॉर्डर आहे ती उभी जाते आणि पुन्हा पेल्विक बॉर्डर आहे पुन्हा खाली तिरपी जाते. इट क्रिएट्स अन हेक्झागॉन, षटकोन तयार होतो. आणि हा षटकोन हा त्या शशी रिलेटेड आहे. म्हणून शंख याचा जर आपण व्यवस्थित उच्चार केला तर ॲब्डोमिनल ऑर्गन्स मध्ये प्रॉपर व्हायब्रेशन्स क्रिएट होऊन इंटेस्टायनल फंक्शन्स, इवन पॅन्क्रियाटिक फंक्शन्स, लिव्हर फंक्शन ही सुधारलेली दिसतात. आणि शंख, शंकराचा शंख या ठिकाणी मुद्दाम शंकर म्हटलेला आहे आणि तो शंकर म्हणताना अनुस्वाराच्या नंतर जो प येतो त्यामुळे तो अनुस्वाराचे उच्चार आपोआप त्या क ख ग घ ङ मधल्या ङ मध्ये प्रमाणे होतो. म्हणून शंकराचा शंख म्हटलाय मी. तर ह्या शंखचा जर विचार केला तर शंख म्हणजे कसं आहे, जर पेशंट आपण लेफ्ट लॅटरल पोझिशन मध्ये झोपवलाय असं समजा आणि कोलॉनचा जर आकार बघितला तर तो श सारखा येतो बघा. पूर्वीच्या काळी मुलांना मोशन नाही झाली, युरिन नाही झाली तर आजी किंवा आजोबा शू 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 असं एक सतत म्हणायचे आणि त्यानंतर तो शोचा तिथे ती व्हायब्रेशन्स त्यांच्यापर्यंत पोहोचली की त्यांचे कॉल्स व्यवस्थित व्हायचे, पोट साफ व्हायचे. तर ह्या ठिकाणी कोलॉन हे आयुर्वेदाप्रमाणे अपानाचं कार्यक्षेत्र आहे आणि अपान वायूचं कार्य प्राधान्य आहे ते एक्सक्रिशन आहे, प्रॉपर एक्सक्रिशन. मग एक्सक्रिशन कुठे आहे? युरिनरी ब्लॅडर आहे, कोलॉन आहे, त्यानंतर फिमेल मध्ये मेन्स्ट्रुअल फ्लुइड्स आहेत, यांचं तिथे मेल मध्ये सेमेन इजॅक्युलेशन आहे. हे सगळं एक्सक्रिशन दॅट इज रिलेटेड विथ अपान आणि या अपानाचं कार्यक्षेत्र श आणि बरोबर आपल्या कोलॉनचा जो शेप आहे तो काहीसा श मध्ये जातो आणि त्यामुळे या ठिकाणी आपल्याला या वंग शंख शंख आणि काही प्रमाणात संग याचा उपयोग होतो. संगचा बऱ्याच वेळा फायदा झालेला आहे, तो थाय पेन आणि नी पेन मध्ये पर्यंत झालेला आहे आणि त्या पद्धतीने आपण या अवयवांचा विचार करत या यांचे उच्चार प्रॉपर आपण करावेत, पेशंटला करायला शिकवावेत, निश्चितपणे त्याचा फायदा होतो. त्या ठिकाणी कुठलेही हे मंत्र हे कुठलेही आपण धार्मिक याच्यातून म्हणत नाही आहोत, तर आरोग्याच्या दृष्टीने म्हणतोय. हे बऱ्याच वेळा आपल्याला काही पेशंटला सांगावं लागतं. तसंच आता सध्याच्या कोरोनाच्या काळात बऱ्याच वेळा पेशंटचं ऑक्सिजन लेवल कमी होत जाते किंवा जेवढी पाहिजे तेवढी वाढत नाही, ब्रीदिंग प्रॉब्लेम असतात. तर ह्यामध्ये अनुभवाला म्हणजे रिंग 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 असं जर आपण प्रॉपर उच्चार केला तर ती व्हायब्रेशन्स लंग्स मधनं सगळीकडे पसरतात आणि त्यामुळे लंग्सचं कार्य सुधारलेलं दिसतं. ठचा हार्टवर आपण उपयोग खूप वेळा वाचण्यात आपल्या व्हॉट्सअपवर खूप वेळा आपण बघितलेला आहे आणि त्याचाही खरंच चांगला उपयोग होतो. केवळ ओमचा उच्चार फक्त आपली मान आपल्या आय लेवल पेक्षा थोडीशी वरती 5 ते 10 डिग्री वरती ठेवून जर आपण प्रॉपर ओमचा उच्चार केला तर ब्रेन मध्ये याचे खूप चांगले आपल्याला व्हायब्रेशन जाणवतात. सहस्रार चक्रावर, आज्ञा चक्रावर त्याचे आपल्याला परिणाम चांगले दिसतात. त्यामुळे पिच्युटरी फंक्शन चांगलं होतं. वेगवेगळे एंडॉर्फिन्स प्रॉपर लेवलमध्ये सिक्रेशन्स होऊन शरीराचं ओव्हरऑल फंक्शन सुधारण्यासाठी त्याचा आपल्याला खूप चांगला उपयोग होतो. आणि अजून यामध्ये बरंच काही संशोधन बाकी आहे, ते ज्याप्रमाणे पुढे पुढे येईल निश्चितपणे मी तुमच्याशी शेअर करेन. बस एवढं सांगून मी आता माझं भाषण थांबवतोय.
Thank you, sir. Dr. Aziz?
Yes, ma'am.
Yeah. There are
Can I start question, ma'am?
Yes, questions. I think we can start
Yeah.
with the questions.
Yes, ma'am. Question number 1 is please tell the weight loss points and renal colic points again?
Again, okay. Renal colic point 1 is on the posterior medial aspect of the knee joint. It is in between femur and tibia. The space we can palpate there. And another point is just on the lower border of the pubic bone on both sides of the pubic symphysis. If the renal calculus is on the right side, you have to press only right side. If it is on the left side, you have to press the left side. If it is bilateral, you may be allowed to require press both the points. And for weight loss, again, these 2 points plus the point on the ischial tuberosity, which I have shown on the slide, ischial tuberosity in Ardha Padmasana, our heel touches this ischial tuberosity, and patient can keep the pressure on that, and that will reduce the weight loss. Sorry, that reduce the weight, achieve the weight loss.
Yes. Thank you, sir. So the second question is, how mantra therapy is related to pranic healing?
Yeah, mantra therapy and pranic healing are almost similar. The same thing. We are here only the every mantra, and we are chanting in a particular way. Pranic healing is just given by another person. Here, the mantra can be used even by the patient himself or herself.
Thank you, sir. The third question is, uh, how long should be the time length of chanting for best result in case of treatment?
Yeah, the time lapse. Yeah, we can chant anytime and to the any extent. Even you can start from 5 seconds. It can reach up to 2 to 3 minutes, 5 minutes. It only requires, and you should feel the proper vibrations in your body. Every word has its own wavelength, and this wavelength creates a different vibration. जसं आपण देवळामध्ये घंटा वाजवतो त्या प्रत्येक घंटेच्या त्या धातूचा मेटलचा एक वेव्स असतात आणि त्या वेव्स आपल्या शरीरावर अफेक्ट करत असतात. त्याच पद्धतीने हे मंत्र काम करतात.
Okay, thank you, sir. Next question is, can chanting Bhagavad Gita shlokas help, and how?
Yeah, chanting Bhagavad Gita shlok definitely has a benefit, as we are seeing this single word can help you a lot. In Bhagavad Gita, there are many words, and those are in a proper sequence, and these vibrations they are created in that sequence, and that helps definitely to concentrate your mind, and then the control the secretion of the endorphins, and that way the proper endorphin levels will improve your body function.
Thank you, sir. Which yoga mudra is best while chanting mantras?
Jnana mudra, that is the tip of the finger, first index finger is to be, this is the yoga mudra, and
Yes.
it
Yes.
should be in a supine position. Our hand should face to the sky.
Yes, sir. Thank you, sir. Continue, sir. You're telling. And next question, can I go for next question, ma'am?
Yes, sir.
Which are the acupressure points for benign prostate hypertrophy healing?
Benign prostatic hypertrophy, the pressure points are again on the lower border of the pubic bone mainly, and just prior to that we can have a point on the arch of the our foot, the topmost point on the arch of the foot,
Yes, sir.
that should be tried first, and then we can uh, treat on the pubic bone point. Utmost to the extreme points is on the clavicle, that is the lateral third and middle third and medial third. The joint, the that point is to be placed from top to bottom.
Okay, sir. Thank you. So the next question is uh, points for incontinence of urine in females.
Uh,
Uh,
yeah, that is the pubic tubercle point. In females, we can see that the insertion of the round ligament point, that helps very nicely for the incontinence. And
and also,
thereafter, if needed, again the clavicle point.
okay, sir. Thank you. Sir, which are the points for releasing the pain of dysmenorrhea in females?
Uh, Releasing pain in dysmenorrhea, these are on the back sides, just the two ticks of the uh, buttock. That will definitely reduce the dysmenorrhea.
Sir, next question is points for knee pain.
Yeah, knee pain at the points on our finger. Yeah, I forgot to say that our two fingers, that is little finger and ring finger, these are used to treat the lower limbs, and the index finger and middle finger to treat the upper limbs. So for knee, we can see that this is an hip joint, thigh. Then the proximal first interphalangeal joint is knee pain. For knee pain, then leg. The distal interphalangeal joint is for ankles, and distal phalanx is for foot. Similarly, in these two fingers for hand, shoulder, arm, elbow, forearm, knee, uh, wrist joint, and palm, like that. We can see
Thank you, sir.
that.
Sir, the next question. Hello.
Yes.
The next question is from Dr. Chaya Dandekar. Which point will help to relieve lumbosacral pain and sciatic pain?
Yeah. For lumbosacral pain, as I said, that all these points of little finger, then also thumb, and this web will show this midpoint to this point. These are for lumbar pain or all the spinal pains. This pain, this line. So this is lumbosacral, thoracic, and cervical. Similarly, on the lateral aspect of second metacarpal bone is this full border is also used to treat the spinal pains. Also on ear, what I showed in the slide, this cervical spine, thoracic spine, and lumbar spine.
So the next question from Dr. Bhatt. Is there any acupressure point for hyperactive children to increase concentration or any mantra?
Yeah, Omkar is the best way for treating. Another, the massage to the thumb around nails, that helps in hyperactive patients or even any irritable patient, not just hyperactive, but many times we have got tensions, a lot of the tensions, and this they create की अरे बाबा हे करू का ते करू ते करू मला काही त्रास देऊ नका मला कोणी काय बोलू नका असं अडल्ट मध्ये सुद्धा आपल्याला बघायला मिळतं. तर त्यावेळेला जर आपण आमचे दोन्ही नेल्स आहेत, नेल्सच्या दोन्ही बाजूनी जर प्रेशर दिलं तर निश्चितपणे त्याचा फायदा होतो. त्यानंतर इयर लोब, आपल्याकडे जे काम पकडायची सवय आहे, आपण इयर लोब पकडतो, तो सुद्धा त्याच्यामध्ये खूप उपयोगाचा आहे. त्याशिवाय अगदीच म्हणजे सगळ्या याच्यामध्ये आपल्याकडे पॉवर योगा जो आहे आता नवीन सुरू झालेला, पूर्ण कान पकडता, म्हणजे त्या पद्धतीने जर आपण कान पूर्ण पकडला तर दॅट इज व्हेरी नाईस. या कानाच्या बॉर्डरवर आपल्याला आपले जे षड्रिपू आहेत त्यांचा सुद्धा उपयोग करता येतो. काम, क्रोध, राग, लोभ, मोह आणि मत्सर. मत्सर हा आतल्या बाजूला आहे. आपण पूर्वीच्या बऱ्याच जणांच्या कानात बिगबाडी बघितलेली असेल. ती बिगबाडी ही मत्सर निर्माण होऊ नये किंवा कमी यावा याच्यासाठी असते. म्हणजे याच्या मागे सुद्धा खूप मोठं शास्त्र आहे. कोकणातल्या स्त्रिया किंवा बऱ्याच वेळा नेपाळी किंवा कच्छ वगैरे या बाजूला बघितलं तर कानामध्ये भरपूर टोचलेलं असतं, 5-5, 7-7 ठिकाण टोचलेलं असतं. हे सगळे त्यांचे षड्रिपू त्या ठिकाणी त्यांच्या कंट्रोलमध्ये असतात. तर त्या पद्धतीने आपल्याला त्यांचा उपयोग करून घेता येऊ शकतो.
So the next question is, what are the scopes and limitations of this non-pharmacological system of treatment?
Yeah, definitely a very nice question. These have definitely some restrictions, some limitations. Every science has limitations. Nothing is in 100% perfect. But when we are at very odd position, suppose we are traveling somewhere in a train, in plane, in bus, or at a function, we don't have our instruments with us. At that time, at least, these will definitely help. Or where the lot medicines are required. So to reduce the dose of the medicines, we can treat these non-pharmacological part.
Sir, thank you very much for your rational and comprehensive explanation. Ma'am, is there any question?
No, sir. We have almost taken everything. Most of the questions.
Yeah.
Yes.
Thank you, sir. Thank you very much for your lucid explanation of very important subject, which can be utilized at any aspect, each and every aspect of life, in most easiest way and handy way. Thank you, sir. I hand over the mic to the respected secretary, sir.
Thank you, sir. I, Dr. Sriyam Joshi, Secretary GPA Pune, extremely thankful to today's speaker, Dr. Keshav Gujrathi, sir, for giving a lecture on different subject. I also thankful to today's convener, Dr. Ejaz Maniar, sir. I also thankful to our technical partner, White Coat. And last but not least, today's doctor who attended this lecture, I am very thankful to them also. Thank you all. Take care.
Thank you, sir.
Okay.